Good day, everyone. I'm Sitti and today Nino and I will be tackling about Faye Glenn Abdellah, one of the most successful and famous nursing theorists.
Thank you, Sitti. Good morning, everyone. I am Nina Lazegi, and first I would like to talk about Faye Glenn Abdallah's biography. So, what inspired Faye Glenn to become a nurse? It was in 1937, the day she saw the Hindenburg, which was a disaster that occurred in New Jersey, the day she saw it explode. And then in 1960, she was influenced by the desire to promote client-centered comprehensive nursing care. So Faye Glenn was born on March 13, 1919 in New York City. She graduated magna cum laude from the Fitkin Memorial Hospital School of Nursing, which is now called Ann May School of Nursing in Neptune, New Jersey, 1942. She obtained her Bachelor of Science in 1945, her Master's in Arts in 1947, and her Doctorate of Education in 1955 from the Teachers Colleges at Columbia. She was then appointed Chief Nurse Officer of the USPHS, or the U.S. Public Health Service, in 1970 and served that position for 17 years. She was the first woman to serve as a deputy surgeon, and she was inducted in the U.S. National Women's Hall of Fame in 2000 due to her contributions in the field of education and nursing research. She has been a staff nurse throughout her career, as well as a head nurse and a faculty member at Yale University and Columbia University. So, Faye Glenn's theory is called the Abdallah's typology of 21 nursing problems. So for the first one is to maintain good hygiene and physical comfort. So after any procedure or most procedures, patients are usually tired and soiled. It is therefore important to clean them properly and make sure they are physically comfortable. For the second is to promote optimal activity like exercise, rest, and sleep. Patients who are sedated during the procedure, uh, nurses are it is the nurse's job to stay in the unit until the effect has decreased to a safer level. So we have to make sure that the patients are able to rest well and sleep well. For the third, it is to promote safety through prevention of accident, injury, or other trauma, and through the prevention of the spread of infection. So it is the nurse's job to make sure side rails are always up when leaving the patient and the patient is on the bed. And one way to prevent the spread of infection is through proper disinfection of any equipment used. Number four is to maintain good mechanics and prevent and correct deformity. So positioning the patient properly, allowing the normal anatomical position of body parts. The number five is to facilitate the maintenance of a supply of oxygen to all body cells. So when patients manifest breathing problems, oxygen is then attached to them. So most sedated patients are attached to a cardiac monitor and a pulse oximeter. When oxygen saturation falls below the normal levels, the rate of oxygen is increased accordingly. Number six is to facilitate the maintenance of nutrition of all body cells. So patients undergoing endoscopic procedures are on nothing by mouth or NPO, which is they are fed supplements through their nose. It is important to monitor blood glucose level when the patient's blood glucose falls from normal value. D50W is then injected to the patient or a change in the patient's IVF. Number seven is to facilitate the maintenance of elimination. So when the patient is inserted with a Foley catheter, providing bedpans or urinals are important for these patients at most times. Number eight is to facilitate the maintenance of fluid and electrolyte balance, proper regulations of the intravenous solution. Number nine is to recognize the physiological responses of the body to disease conditions such as pathological, physiological, and compensatory. It is important to check the patient for signs of internal gastrointestinal bleeding by monitoring the blood pressure and cardiac rate. Number 10 is to facilitate the maintenance of regulatory mechanisms and function. So when patients have difficulty in breathing and is showing an increase in respiratory rate, elevating the head part of the bed is done to facilitate the respiratory system or to help the patient breathe properly. So now I will be passing the floor to my partner Sitti to talk about the rest of the theory.
Then, next to Faye Abdallah's 21 nursing problems is the 11th typology. This is to facilitate the maintenance of sensory function. Semi-conscious patients are partly conscious. It is necessary to talk to them while performing nursing interventions to maintain auditory sense. The 12th one is to identify and accept positive and negative expressions, feelings, and reactions. Most patients feel anxious before undergoing procedures. It is necessary to listen to the expressions of these patients and allow them to ask questions. To decrease anxiety, proper instructions are given, what they are to expect and how long the said procedure will take, as well as what they should do during the procedure and after the procedure. So in short, we should communicate with the patients. The 13th one is to identify and accept interrelatedness of emotions and organic illness. Encourage patients to verbalize their feelings and allow them to cry when they have the need to do so. Patients are usually diagnosed with malignancy after the procedure, and during this time, the emotional needs of the patient is a priority. 14. To facilitate maintenance of effective verbal and nonverbal communication. When patients are not able to express themselves verbally, it is important to assist for nonverbal cues. For instance, when patients are in pain, assessing for facial grimace. 15th, to promote development of productive interpersonal relationships. Allow the patient's significant others to stay with the patient before and after the procedure. This allows for bonding and promotes interpersonal relationships. Number 16, to facilitate progress toward the achievement of personal spiritual goals. Nurses usually visit the patients in the unit. Patients may benefit from this, allowing them to practice their faith by sharing views, values, or beliefs in order to feel that there is hope. Number 17, to create and or maintain a therapeutic environment. Providing proper lighting, proper room temperature, a quiet environment is given to patients staying in the unit. This is to feel at peace and to make the environment comfortable. Number 18, to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. Care to patients vary according to their developmental needs, such as allowing the parents to stay during procedure help the pediatric patients in their emotional and developmental needs. Number 19, to accept the optimum possible goals in the light of limitations, physical and emotional. The goals for each patient vary depending on the capability of the patients. The nutritional goal for a patient with a PEG or PEG tube will be different, knowing that the patient has limited feeding options. Number 20, to use community resources as an aid in resolving problems arising from illnesses. Some patients live far away from the city and thus referral to health centers is sometimes limited. Number 21, to understand the role of social problems as influencing factors in the cause of illness. Some patients who are diagnosed with amoebic colitis, for example, are advised to focus on food that are prepared properly. Okay, so let's proceed to Faye Glenn Abdellah's personal, environment, health, and nursing perspectives. In the personal perspective of Faye Abdellah, she worked on the problem-solving method which delineates nursing patient problems as the patient moves toward a healthy outcome. This means that Abdellah worked on the problem-solving method by describing, portraying, identifying the patient problem in order to meet the health outcome or to provide the care and needs of the patient. She also contributed to the nursing theory development that introduces the systemic analysis of research reports and creation of the 21 nursing problems. This means that she proposed the theories and methods with the use of research in order to clearly understand the patient's needs and problems. In Faye Abdallah's personal perspective, she created the 21 nursing problems which appeared in her book called Patient-Centered Approaches to Nursing. The 21 nursing problems which was previously discussed is explained also in her book, in a research base in order to provide patient care or quality patient care. Next is the environment perspective of Faye Abdallah. In Faye Abdallah's contribution in nursing, she focused on educating the public by knowing and applying the 21 nursing problems in topics such as AIDS, drug addiction, violence, smoking, and alcoholism. In her theories, she focused on the maintenance and safety of the internal and external environment to promote a therapeutic environment and awareness. Next is the health perspective of Faye Abdallah. Based in Faye Abdallah's 21 nursing problems, she focused on good hygiene, physical comfort, maintenance of body's nutrition, fluids, and mechanisms. Overall, she focused on the physical, emotional, and developmental needs of an individual for comprehensive nursing care to the patient. Next is the nursing perspective of Faye Abdallah. Abdallah's perspective in nursing is to aim at a problem-centered approach in the philosophy of nursing to formulate nursing-centered services to determine the patient's needs. Also, in her nursing perspective, Abdallah's views in nursing as art and science that mold the attitude, intellectual competencies, and technical skills of the individual nurse into the desire and ability to help individuals cope with health needs whether they are ill or well. In summary, of Faye Glenn Abdellah's contribution to nursing was her passion and pursuance of improving and strengthening the nursing school infrastructure in education and in any institution of nursing has led to many discoveries and implementations in patterns of providing the best quality patient care in any environment with her contribution of the 21 nursing problems. Thank you everyone for listening about Faye Abdallah's journey and contribution to nursing. Let this be our inspiration to pursue and improve nursing to provide the best quality patient care. Padayon!